You're watching the Isaiah Factor Uncensored.
And welcome back to The Factor Uncensored, the second half hour. Tonight, social media influencers are the new celebrities. Younger ones can have a real impact on pop culture too. Businesses often offer them free services in exchange for promotion, and that includes, get this, plastic surgery. One plastic surgeon I spoke with says he has seen skyrocketing plastic surgery demands from younger folks, and in many cases, getting work done has become an addiction.
I think people are losing touch with reality. They're playing with these apps and face tuning their face and changing how they look, and they have an altered sense of reality, and they have this new online presence that they're trying to match by doing fillers or Botox. And I think they're pressured not only from the social media, but sometimes when they go into these offices, trying to get them to do new procedures and treatments.
Now, how dangerous could this be for young people, both physically as a result of getting all of these procedures done, and mentally it could do damage as well?
No, definitely. When you're getting a procedure or treatment, the informed consent is very important. And sometimes people go in, think, oh, it's very easy, it's quick, they're offering it to me and I'll just get it. But when you do multiple treatments, you don't know the risks and the benefits of the treatment you're having, or you're going to a provider that really doesn't know what they're doing or doesn't have the experience, it can really affect the outcome that you're going to have. That's why it's very important when you're going for a treatment that you're getting done by a qualified and certified person, such as a board certified plastic surgeon or dermatologist, not just some corner place that just started dabbling in injectables or treatments.
Now, could this lead to addiction for young people if it's so easily accessible to them and they're doing it or getting it for free?
Definitely. And part of my job as a board certified plastic surgeon is to know when to say no. And I have to be the gatekeeper for some patients that come in. You get people that go from doctor to doctor and store to store looking for different treatments to have done. But sometimes the answer is no, you've done enough, you look natural. And sometimes I have patients I've told no, they go somewhere else, they get pressured into doing more treatments or fillers, they look unnatural, they have a bad result, and then they come back and they say, Dr. Schaefer, you know what, you're right, how can we fix this now? But it's better to get the treatment done right the first time than to have to fix it later down the road.
And how much of a hassle is it to reverse bad work?
Like I said, it's always better to get it done right the first time. There are treatments that we can do. The fillers, we have an antidote that we can inject that helps melt them or helps your body metabolize it sooner. Botox, if you have a result that you don't like, it always wears off. But when you're having surgery, you're getting cut with a knife, you have an incision, that's something you can't reverse. So that's why it's very, very important that you're going to a well-qualified person, such as a board-certified plastic surgeon.
Now, if you have a young person in your family and they may be a social media influencer, or they're getting these aesthetics as a result of what they see on social media, what should you do? What would be your advice to, say, a mother or father or friend, and they see someone who's just morphing in front of their face?
Yeah, sometimes, back to when people had drug addiction and you had to have interventions, you may have to have an intervention with somebody who's doing too much with these treatments. Again, people look at themselves on social media, how they morph themselves online, and they lose touch with reality. So sometimes you have to have a discussion with the patient. And I'll tell patients, I'll say, listen, you're not looking natural. What are you doing? Have you been going to other places? In the past, a patient would go to one doctor and stick with that doctor. But a lot of times now, because of social media and influence, they go shopping around to different treatments in different offices, and you don't know what they've had injected in their face. And that's what makes it very difficult for me to try to correct what they've had done when they come in and they say, Dr. Schaefer, I don't know what I did, but can you help me?
Now, for those who are not able to they're not able to approach that family member or friend with the advice that you just don't look natural, what would you recommend they do if they're not able to say that to someone? I know it would be difficult to me to say, look, you look unnatural now.
Yeah, I mean, having open discussions with patients, I think, is the most important. But the burden a lot of time is on the provider. So if a patient comes in, let's say seeking drugs, my responsibility is to make sure that they're not abusing drugs, that they get the proper treatment that they have. The same theory has to apply to people who are seeking these treatments, getting too many treatments done, dangerous treatments done, or treatments that aren't appropriate for their body or their anatomy. So it's dependent on the provider, and that's where the ethics comes in, where you want to have a qualified and certified provider rather than just going to anybody who's willing to do a treatment so that they can get a post on social media.
All righty, sir. Dr. David Schaefer, thank you for joining us with this valuable advice for young people out there.